Good morning and welcome to this segment of the program. Inuagata no Sahai is my name, and I feel so happy to come your way today and make your day so valuable, a very premium, valuable day. Now, there is a service out there that people normally don't find it very appealing, to go and engage that service. There's a product out there that people don't find it very, appealing. They don't find it enjoyable to buy this product or engage this service. But at the end of the day, they don't have a choice because they just need to keep their life going on. They need to engage this service. They need to equally buy this product. I am talking about health service. People normally on their own wouldn't like to go to the hospitals. Nobody like to just go and stay there in the hospital and then somebody is drawing blood out of your vein, somebody is giving you an injection, you are being given some prescriptions to take and you are following them traditionally and all that. People ordinarily on their own would not just want to go to hospitals, they would not just want to buy drugs. Even medical personnel equally don't like being treated. If we were to ask them, that is the gospel truth they tell you. They normally say, there's a saying out there that doctors make the worst patient. Have you ever tried giving a doctor an injection? In short, you may need 5 men to hold this doctor or medical personnel before you can give him that injection. Now, people don't like to engage health services. People don't like to buy health products, but they don't have a choice. They do it all the same, which means that engaging health service or buying health product is a grudge purchase. They do it grudgingly. Yeah, I have to. I need to be okay. So they do it grudgingly. It's a grudge purchase. Now, because it's a grudge purchase, this is the more reason whereby health workers, medical personnel out there in various medical centers and clinics need to wear this human face and exhibit high level of customer service or customer care. The health sector, especially the Nigerian environment, when you look at it critically, you will notice that customer service is lacking. Customer care is lacking. You see the way health officials treat people. They lack this human touch. They lack this humanity. Some of them lack this empathy, this compassion. And at the end of the day, the reason people keep coming to patronize most of them is because they don't have a choice. But you shouldn't do that because they don't have a choice. You just have to make sure you bring excellent customer service to the table. And at the end of the day, if somebody needs your kind of health service or your kind of health product, the person will choose you. The person will always remember you because as you are doing the job, you are not just focusing on dispensing the clinical expertise that is required of you, which is very important. You equally garnish it with a human face. You do it with empathy. You do it with compassion. You do it with so much concern. And one way that can actually help you as a medical personnel, to make sure that you do your job with this human finance, with excellent customer service, in the equation, is for you to not just see healthcare as a job, see it as a calling to serve humanity. See it as a calling to serve humanity. This will bring out the human being in you. This will bring out the compassion in you. This will bring out the empathy in you. It will make you to do the job with not just, dispensing the clinical, expertise like I mentioned earlier on, but you'll be doing it with a lot of humanity. You'll be doing it with empathy. See health service as not just a job, but as a calling to see humanity. There's a challenge we have in our environment today. There are many people that are doctors today, nurses or various medical, expertise fields out there that just got into the profession, into the industry for the money. Years back, as we started growing as a nation, you see people who actually had this calling coming into the field. And as they've been working in the field, they started making some good money, living at least a comfortable life. And some parents saw this, and whether their children liked it or not, they started forcing their children to become doctors, become nurses, or become medical personnel. And these children that some of them that were supposed to be operating machines in the factory as mechanical engineers and all that are now handling human beings. By calling, they are supposed to be working with machines, but today they are working with human beings because, you know, they are now doctors. They got in with the mindset of it will help you to be successful. It will help you to live a comfortable life. And today, many of them do the job with no empathy. They do the job with no compassion. They do the job with no human touch. But to help you out of it, even if you fell victim of this, excuse me, see healthcare, health service as a calling, not as a job. This is just so important. Then also, another way that can help you, you know, to project excellent customer service as you engage in rendering health service is for you to see the patients as not just patients, but as customers. Now, customers, they are the source of cash flow. The money you need to do anything you want to do comes from them. So you see them beyond somebody that has just come for treatment. See them as your source of cash flow. See them as your channel of cash flow. And you know cash is king. Cash is very important. And then at the end of the day, the person that's bringing cash is a higher king. So the customer at the end of the day is actually the king more than King Cash. So you should see them as customers. See the patients as not just patients that came to be treated. See them as your channel or source of cash flow. See them as customers. Let me read something here. A statement that was made by Mahatma Gandhi concerning the customer. He said, the customer is the most important visitor on our premises. He is not dependent on us. We are dependent on him. He is not an interruption in our work. He is the purpose of it. We are not doing him a favor by serving him. He is doing us a favor by giving us an opportunity to do so. So they are just so important. See them as not just patients, see them as customers, and they have come to do you a favor, and that will help you to treat them with this customer service approach and attitude. And number 3, never show indifference to customers and their relatives. Now, what I'm saying is that don't exhibit body languages that shows to them that their presence is inconveniencing you. This is one challenge we have in our clinics, in our medical centers. You see many of the personnel there exhibiting this body language that looks as if your coming is coming to disturb them. Your coming is inconveniencing them. Your coming is making life hard for them. And it is actually your coming that helps pay their salary. It is your coming that helps give them allowances. It's your coming that helps them take care of themselves and pursue their visions and financial goals. And so your coming is very important. So for you as a medical personnel, for you to project excellent customer service in that your clinical center, in that your medical center, you know, don't exhibit a body language that shows to the customer that their coming is inconveniencing you. This is just so important for you. It will help you to exhibit excellent customer service. And then another point that will also help you to exhibit excellent customer service as a medical personnel is for you not to try to match your ego with the patient's ego or with their relative's ego. Never you try to match your ego. Never you try to win an argument. Don't try to show to them that you have PhD in argumentology. It's not necessary. You want them to come around to engage your medical service or your clinical service, and then in the future, should they need it again, you want them to come again. And so you should treat them in a way that they will want to come again. Should they need your service, or should anybody within their sphere of contact also need your service tomorrow, so they can become a referrer for you. So don't try to match your ego with their ego. And then also, don't also try, or let me put it this way, try as much as possible to reduce your communicating with them in medical jargons or lexicons so that they will avoid making mistakes. This is just so important. You know, you'll be trained in that way. This is what you do every day. And sometimes, you know, unconsciously, you may be tempted to just use some Mexico lexicons or jargons that, you know, if you continue like that, these patients, these customers may end up making mistakes when they go home to, you know, engage, to use your product, or, you know, to just do what you want them to do. They may make mistakes. So help them to reduce this. This is just so important. Then as I conclude this morning, try as much as possible to practice patience outreach, patient follow-up. This is so important, especially, you know, for those that have private clinics and all that. You take the contacts of your patients, of your customers, you have them, and when they are finally discharged, maybe the same day or a few days later or some weeks later, now it is for your good that one of these days, 3 days later, 4 days later, you pick up your phone and call them and ask them how are they doing. This will help you to make deposit in their emotional bank accounts, and it is a deposit you will always make positive withdrawal from. I strongly believe that profound value have been added to your day-to-day, especially as a medical practitioner, as a medical doctor, a nurse, a pharmacist, a laboratory scientist. I believe lots of value have been added to you, and I know that you want to reach me, and that is why my phone numbers have been on the screen. The MTN is 080-6686-5060. I take it one more time, 080-6686-5060. The Glo is equally there, is 080-529-29120. Take it just one more time, 080-529-29120. Your day is so blessed. Thank you.